Thank you so much for joining us this evening. Great. Thank you so much for joining us this evening for a really important conversation about body image, intimacy, and cancer. This is not always an easy conversation, but it's an important one. I'd also like to clarify that the program is an inclusive one for those who are partnered, for those who are not, and this is just an important topic for everyone. Before we begin, a few housekeeping items. First, I want to thank tonight's sponsors. Our sponsors enable us to continue to offer meaningful programs. So thank you to Daiichi Sankyo and to Merck. And of course, thank you to our program partner for this evening's program, Northwell Health Cancer Center, for collaborating with us on tonight's program. This webinar is being recorded and will be posted on Sharsheret website along with a transcript for you to use as a resource. As a reminder, I want to assure you that the participants' faces and names will not be in the recording. And if you'd like, you also have the option of being anonymous during today's live webinar. You can turn off your camera and even change the name in your Zoom square. And there are instructions in the chat box on how to make those changes if you wish to do so. I do want to say we received a lot of really important questions through the registration process, but as questions arise, as Dr. John is speaking, please use the chat box and we will address them. We'll make note of them and address them during the Q&A session at the end of the webinar. If you would like your question to be anonymous, you can send it in the chat box directly to me. I'm listed as Melissa Rosen, Sharsheret, and then only I will see it. As a reminder, Sharsheret has been providing telehealth services to the breast and ovarian cancer communities for more than 20 years because cancer is so much more than simply a physical experience. And tonight's topic is the perfect example of that. As we move into the webinar itself, I also want to remind you that Sharsheret is a national not-for-profit cancer support and education organization and does not provide any medical advice. The information provided by Sharsheret and tonight's presenter is not a substitute for medical advice or treatment for your specific medical condition. You should, of course, always seek the advice of your physician or qualified healthcare provider with any questions you may have. Okay, we are so very fortunate to have our speaker with us today. Dr. Veena John is the system head for gynecologic oncology for the Northwell Health Center Cancer Institute and an assistant professor of medicine at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. In addition to providing evidence-based personalized care, she helped to pioneer a multidisciplinary team approach for gynecologic oncology patients at the Monter Cancer Center and Northwell Health Cancer Institute, bringing together multiple specialties to ensure treatment consistency across all Northwell sites. Dr. John is a highly experienced principal investigator for industry-sponsored phase 1, 2, and 3 clinical trials for gynecologic oncology. She is the site principal investigator for the NRG Cooperative Group for the Northwell Health Cancer Institute and co-chair of the Protocol Review Monitoring Committee. Dr. John is also an active member of the Society for Gynecologic Oncology, the Society for Immunotherapy in Cancer, the American Society of Clinical Oncology, and the American Society of Hematology, as well as a member of the Ovarian Cancer Committee for the National Gynecologic Oncology Group. Wow, that is a lot. You can see why we're so excited to have her. So welcome, Dr. John. The screen is yours.
Thank you, Melissa. Can you hear me?
Yes, I can hear you.
Thank you. Thank you for that kind introduction. And I would like to thank the organization, Sharsheret, for giving me this opportunity. I am going to share my screen now, hopefully. Can you see the slides? Okay, beautiful. All right. Good evening, everyone, and thank you for spending your evening with us tonight. As Melissa said, we are going to talk about something very important today, and that is the body image and intimacy and cancer. So, as you all know, treatment of cancer is just one aspect of that disease, and the treatment and the changes that bring along is it could be devastating. The medical treatment for cancer, and this is for all types of cancer, is destructive by its nature, and it often involves loss of body parts and or challenging adjustments to functional limitations. Breast cancer treatment often impacts sexuality, and it's found that surgery is often perceived by women as an assault on a key aspect of their sexual identity. Similarly, gynecological cancer typically affects body parts associated with womanhood and femininity, causing considerable body changes that are likely to alter body image. The physical and the emotional trauma suffered from such experiences can be substantial and chronic. So how does someone remain whole during and after cancer treatment? This difficult disease and its therapies can make patients' relationship with their partners, spouses, and even themselves seem like a tangle of fear, fatigue, depression, shame, and vulnerability. Many may struggle to discuss their changed bodies and strain to define the shifting dynamics and needs of their sex lives. Factors like these make it challenging to discuss post-treatment changes in sexuality, rebuilding a healthy body image, and reestablishing intimacy. So sex, sexuality, and intimacy are just as important for people with cancer as they are for people who don't have cancer. Sexuality and intimacy have shown to help people face cancer by helping them deal with feeling of distress. And when going through the treatment, it's helpful to acknowledge the changes that are undergoing when they're undergoing the treatment for cancer. I'm sorry, I'm just moving the screen a little bit because it's coming over my slides. Okay. So some of the things that people experience when undergoing treatment is a change in their body image, and also change physically and emotionally and mentally how they feel when they're going through treatment for cancer. And cancer treatment, as you may all be well aware, can cause physical, emotional, and mental changes, and that are very difficult and sometimes impossible to discuss with loved ones. There are surgical scars and changes in weight and physical appearance, which can decrease the confidence and induce anxiety. Body image also changes during treatment with different effects, and they affect differently for men and women. And our primary talk today is related to women, so I'll be focusing on that. The most common physical change are hair loss, fatigue, skin dryness, swelling, changes in the weight, scars from surgery, skin discoloration from either treatment or from radiation, and changes in bowel and bladder habits. Some women may experience early menopause immediately after starting chemotherapy, and which may lead to menopausal symptoms that could be very interfering with the quality of life. So understanding how these treatments can affect a person is important to prepare for the physical changes that may take place during treatment. So body image, we all have a different perception of body image, and this is irrespective of cancer or cancer-related treatment, right? So the body image is a person's perception of their physical self and the thoughts and feelings, and they could be either negative, positive, or both. More importantly, this may be very different than what others see. So what you see yourself as could be very different from what someone else looks at you and perceives you as, right? It's very common to hear from our patients who underwent surgery to talk about certain things, like women with breast cancer tells us that she can no longer stand to look at herself in the mirror or show her body to her husband after a mastectomy. Okay? That is because it brought on a physical change that is new, and it is difficult to accept that change, and they feel that they are missing something. So to have a positive body image relates to being satisfied with your intimate relationship. So even though I have broken my talk into body image and intimacy and sexuality separately, but they are all interlinked and connected. None of them are standing alone. They are all linked together. Okay. So women diagnosed with cancer under the age of 50 report decline in sexual satisfaction, frequency of sexual behaviors, and sexual function more often than older people. What is self-image? So the body image is one thing, and self-image is something that what you think of, right? So self-image is how you think about or see yourself as. And self-image may be closely tied to the body image. And some of the changes to how you feel about your self-image may be positive and some may be negative. So what is normal during treatments during cancer diagnosis? And there is that normal is in quotation for a reason, because it's a different normal. Cancer surgery may affect your feelings about sexuality. These changes may affect self-image, self-confidence, and sense of attractiveness. Young women are concerned about body image more than older women, and these changes may impact your quality of life. In people with history of breast cancer, 80% of those between the age of 34 to 49 covered their bodies during sex, and 40 to 60% of the older people did too. Okay, and that is because of how they perceive their body and how they look at themselves. And so if you feel a change in your body image, and you feel there are issues with intimacy while you're going through chemotherapy, while you're going through treatment for cancer, it is very normal. Okay, you have to understand that, and you have to talk about it. Some of the physical changes that we see while a person is undergoing treatment is hair loss, change in weight, surgical scars, loss of an organ like as breast, fatigue, and the sexual health issues that they may encounter. Hair loss is something very visible, right? That's the first thing someone may recognize or look at you, and they look at and see the change. And it is unfortunately a very common side effect of majority of the chemotherapy agents. And it can be challenging because it brings on a change in the physical appearance, and also emotionally it's difficult. Okay. Many of our women cope with hair loss differently. Okay. But I would say 90% of it is devastating when I tell them that the treatment may cause or will cause hair loss. And talking about your feeling with a counselor or a family member or a close friend may provide comfort. Sometimes it is helpful to prepare your family and friends to let them know of your losing hair. And if sometimes patients cut their hair very short, so that when the actual hair loss happens, it's less traumatic to watch the hair come out. Okay, and now we do have something to mitigate or lessen the side effect of the hair loss, and that is the cold cap therapy. The cold cap is something that a woman puts on her head while undergoing the infusion, the chemotherapy infusion. And that basically is trying to prevent the chemotherapy going into the scalp, and hence hopefully prevent you from losing hair. It is unfortunately not covered fully by insurance yet. So it is an out-of-pocket cost, which can be substantial. And, so not everyone is able to afford it. And sometimes even women who have tried it may find it very uncomfortable and may choose to not do it anymore. So one of the other changes that women may notice while undergoing treatment is weight changes. During cancer treatment, it's very hard to maintain your weight. Surprisingly, and a lot of my patients are surprised when I tell them that they may not lose weight, they may actually gain weight, okay? And excessive weight gain in general is not good. And sometimes it's shown that if someone gains too much weight during treatment, the recovery may be also delayed or poor. And also with added weight gain comes other medical issues like heart disease, diabetes, and heart problems. Also, because of the weight changes, it brings in a lot of emotion of feeling ashamed, and they may be discriminated because of their weight. And sometimes the weight gain is a direct result of the treatment. So if they are having and struggling with issues with weight, please speak with your healthcare provider and discuss this directly with them, because it may not be because of what you do or don't do. It may be a result of the treatment that you're getting that is making you gain weight. Of course, there are things like eating healthy, eating a lot of fruits and vegetables and whole grains that may help you maintain your weight, trying to avoid fat, sugar, and refined flour, drinking plenty of water, and use healthy cooking methods whenever possible. These all are, of course, helpful tips. But sometimes I see my patients struggle. They say that I do all these things. I exercise, I eat right, and yet I'm still not able to lose weight, and I'm still gaining weight. And there could be other reasons for that. It could be stress related. It could be the medication you are on. It could be depression. So it is important to talk to your healthcare provider so that they can look at the whole picture and see what needs to be done to address these issues. Fatigue, as you all know, is a very, very, very common side effect from treatment as well as from the cancer itself. And the cancer-related fatigue can affect your day-to-day activities and quality of life. And this fatigue does not just go away when you're done with your treatment. Unfortunately, it may linger and may last even after months of finishing treatment, or sometimes even years after finishing treatment. Some of the ways to cope with the fatigue is to actually look and see what is causing the fatigue. And sometimes there could be a very clear reason for the fatigue, like pain. You know, pain can be very tiring and fatiguing. And sometimes treatment that you're getting for the pain medicines, the side effects of the pain medicines could be fatigue, okay? Emotional distress, depression, and anxiety, sometimes it gives you fatigue, it gives you a physical feeling. It's not just a mental thing, it gives you a physical symptom, and that is fatigue. Poor nutrition, low hemoglobin, which is anemia, sleep disturbances may also add to the fatigue. And sometimes it's a combination of all these factors that is giving you fatigue. It helps to keep yourself active and keep yourself moving. So, and I'm not saying in terms of exercise. I mean, that would be great if you're able to exercise, do walking and some aerobic exercise, that will be great. But if that is limiting, you can try to do some hobby like gardening, or, you know, just be active as much as possible. That definitely will help. But at the same time, when you're not feeling well, take time to relax. Schedule some rest in your day so that you may conserve energy for when you need it. Eat well. I mean, that goes without saying because it is important on many levels. Good sleep habits. If you don't have good sleep habits, that will translate into fatigue. Okay, so make sure when you go to bed at nighttime, you don't bring any electronics with you. Shut off your computers, shut off your laptops. Don't bring your phone with you if possible. So I know it's impossible to do that. We all are guilty of doing it, but try to do that to get a good night's sleep, because that is important to mitigate the fatigue. Sometimes engaging in mind-body strategies help, like yoga, meditation. If you're interested in some therapy and counseling, there are therapists out there who may help you, guide you in how to fight the fatigue. And of course, a massage will always help to, even if not a long-term, temporarily, massage may help you get some relief from the fatigue, right? Now, physical body image changes, emotionally feeling fatigued, in pain, and all this also interfere with intimacy, right? So one of the most difficult subjects to deal with during and after cancer treatment is intimacy. And it is different for men and women. So the most common difficulties in physical intimacy during and after cancer treatment for women could be pain during intercourse, early menopause and its symptoms, loss of confidence, loss of sexual desire, anxiety, depression. All this may lead to problems with intimacy. So the physical and emotional changes that comes with cancer treatment includes, it affects your sex life. Okay, so that's why I said the physical change, the emotional change, all are interlinked. And the sexual side effects of the treatment can be physical, mental, or emotional. So I can tell you, as a healthcare provider, we rarely bring up this subject to our patients, and I'm guilty about that. Okay, we rarely initiate the subject of sex life and how you're doing. If the patients bring up the subject, we definitely would engage in it further. But it is something that we as healthcare provider need to work on it, because it is an important part of the whole treatment, to treat the whole person, not just one part of their life. Okay, so please talk openly to your healthcare provider, and I can guarantee you no healthcare provider will brush you aside saying, oh, I don't want to talk about this. Okay, if you initiate the subject, everyone will be interested in, and will be able to help you about the sexual health part of it, and what you're dealing with, and what changes you're experiencing, and what they can do. And if the healthcare provider is not able to give a good answer or take care of it, they may direct you to or refer you to the appropriate people who can help you with that. Okay. And sometimes it helps to bring these subjects up even before the treatment started, if possible, right? So, but I know that's the last thing on your mind when someone is diagnosed, given a new diagnosis of cancer and treatment and surgery. You probably are not thinking about sexual health and intimacy at that point. And I understand, many patients may not bring that subject up before the treatment starts. So the sexual problems may develop during, right after, or years after treatment. And sometimes it goes away, and sometimes it remains and may become permanent. So potential sexual side effects that we commonly encounter is decrease or loss of sexual desire, inability to achieve or maintain sexual arousal, decrease or loss of lubrication, difficulty or inability to achieve orgasm, pain during sex, pain or numbness of the genitals. And all these sexual problems could be from direct result of the treatment or the kind of treatment that was given. So radiation therapy, especially if the radiation therapy was given to the pelvis, that can cause vaginal dryness, soreness, and pain, and it may last even after the radiation is over. Okay, and sometimes the long-term side effects of the radiation could be scar tissue formation, which leads to narrowing or shortening of the vagina, and such changes can make penetrative sexual activities painful or even impossible. chemotherapy side effects affect emotionally as well as all the desire to have sex. It is affected, especially with the self-image being distorted or not feeling well. The desire to have sex is not there, and that's a direct impact of the chemotherapy side effect. Certain surgeries also will directly affect sexual or give sexual problems, and especially if the surgery is a GYN surgery where the women's reproductive organs are taken out, and if the vagina was, there was surgery in the vaginal side or the cervix, if the nerves and the pelvic floor was affected, these all can lead to some sexual problem. And surgery may also cause narrowing of the vagina or may give chronic pelvic pain. Hormonal or endocrine therapy, as you know, it's a very common treatment for breast cancer patients, and they are on this treatment for very, very long time. Some of them are at 5 years, some of them are for 10 years. So these treatments bring in the menopausal symptoms, and those symptoms that we commonly see are hot flashes, vaginal dryness, pain during intercourse, and lowered sex drive. Out of all the four symptoms, the hot flashes, even though it is not a direct sexual problem, indirectly it impacts your sex life, right? So women having these hot flashes very frequently will not have any desire for sex. Okay, so so there are certain things that you can do to mitigate or decrease the frequency of hot flashes. Some of them are behavioral therapy on how to cope with these hot flashes so it's not as bothersome. And some of them could be to decrease the frequency. So be aware of certain foods that can trigger hot flashes. Okay, so like hot, spicy food, caffeine, alcohol. Okay, so all these can trigger a hot flash. Okay, so be aware of that, especially when you are going to be intimate, right? You don't want to take any of these things so that you don't get too many hot flashes, right? And also don't if you're exercised just now, there is a potential that can trigger a hot flash, right? So immediately after going to the gym or to the exercise, if you plan to have sex or be intimate, sometimes you have to be aware that you may get hot flashes. And also talking to your partner and letting them know about hot flashes, because at the time of intimacy, if you have an episode of hot flash and you stop whatever you were doing, you know, your partner shouldn't think that he or she did something wrong, right? It needs to be, it's communication and letting them know, okay, I have this episode, let me relax, let me feel better, and then, you know, we will continue or to that effect. But it is important to communicate so that everyone knows what's going on and nobody feels that someone did something wrong. Okay, so important communication skills and communicating with your partner is very, very important. So going back to the hot flashes, there are certain, if the hot flashes are getting too much and you have tried all the methods to decrease the frequency, please speak to your healthcare provider, because there are certain prescription medications that may alleviate the symptoms. Mostly they are antidepressants. Paxil and Effexor are some of the common drugs that we prescribe for hot flashes. Certain anti-seizure medications like Lyrica and Neurontin are other drugs that may help decrease or lower the frequency of these episodes. Yeah, there are a lot of over-the-counter medications that are sold saying that will lower the or stop hot flashes. Just be careful what you take. Some of the things that has been marketed as like black cohosh, vitamin E, soy products, and also ginseng. All these, they claim to lower the incidence of hot flashes. There's not much data, so it's all individual testimonials on how things help each individual person with those products. But to word of caution on certain products like black cohosh, if you take it too much, it can affect your liver. And if you take too much vitamin E, that may lead to thinning of your blood and may lead to problems with bleeding. So just discuss with your healthcare provider, even if it is over-the-counter medications, that let them know that you're taking them and make sure that it's safe to take. So our mental health is directly linked to our sexual health, and certain emotions because of the cancer and its condition may impact your sexual function. And of course, one of the biggest fear is the fear of recurrence, right? So returning of the cancer. Also, there is fear of powerlessness, like there's nothing you can do, and sadness and frustration. Negative feeling about the body changes that happen due to the surgery or to the treatment that you underwent, and stress, depression, anxiety. All this thing, mental health issue, can affect your sexual health. And also, very important to remember, while you are going through all this, your caregiver and your partner and your a friend, whoever is with you there to support you, are also going through certain mental emotions that and experience that they feel is challenging, right? So it's very common when the the partner or the spouse tells me that I see her suffering, but I don't know how to help her. Okay. And I try to do something, but I feel that it's not enough. So don't be bashful, don't be shy. Tell them what makes you feel good. Okay. Tell what works and what doesn't work. Okay. So it is important. And also that will also make the partner feel that they are offering something and they're supporting you in the right way. Okay, so talk to each other about your feelings and concerns, including the sexual health. Okay, having these feelings without talking about them may get in the way of being intimate, both physically as well as emotionally. So some of the physical symptoms that a woman may undergo because of the treatment, like the vaginal stenosis and fibrosis and things like that, and the menopausal symptoms, that is directly related to painful intercourse. Okay, and painful intercourse is it's something that affects a lot of women, but they are not discussing that with anyone. Okay. There are certain things that we can do to alleviate some of the symptoms, and it is important to discuss that with your healthcare provider so that those issues are addressed earlier on during the treatment before some permanent changes set in, and it's difficult to change that. Okay. So some of the things that commonly used is vaginal lubricants, vaginal moisturizers. There is pelvic floor physical therapy, vaginal dilators, and low-dose vaginal estrogen cream. There is intravaginal DHEA cream. There is vaginal lidocaine. So there are multiple things that can be used locally to lessen the pain during intercourse. And many a times, these treatments are used in combination to improve the sexual comfort and pleasure. And you may need to talk to a sex therapist or join a support group to get more information. So dyspareunia is the physical medical terminology used for painful intercourse. Okay, and it is the most common sexual affliction among women cancer survivors. And this is a direct result of low estrogen level, okay, which causes atrophy of the vagina and the vulva, okay, or it may be a direct result of surgery, chemotherapy, or radiation. And also the hormonal treatment that is given for breast cancer may also result in these symptoms. Okay, so there is also a certain amount of dryness and thinning of the wall of the vagina, and it becomes inflamed, so that any kind of contact in that area will be very painful. There is loss of lubrication. So estrogen keeps the area very moist, and because the estrogen is not there, it becomes very dry. Okay, and there is loss of elasticity and thinning of the lining of the vagina, which leads to an increase in discomfort or pain. Women, when they try, when they're having intercourse, it may end up resulting in some small lacerations because of the friction. It causes irritation and causes bleeding, and they may develop postcoital bleeding. So how to treat painful intercourse or painful, and it is, there are two different ways of doing it. One is a non-prescription, non-hormonal approach, and then the other one is a hormonal therapy. So the non-hormonal approach is using vaginal moisturizers and lubricants, which every menopausal women should be using it, because the moisturizer should be used regularly, several times a week. Okay, the lubricant, it is supposed to be used at the time of sexual activity. Okay, so the moisturizer is something that needs to be done every day, almost every day, but the lubricant is at the time of sexual activity. And there are a lot of products that are available over the counter. Preferably a water-based or silicone-based product should be used. Sometimes lidocaine, topical lidocaine may help, especially if there is a severe penetrative dyspareunia. Then using that lidocaine may help decrease the amount of pain and reduces the sexual distress and may improve comfort with penetration. Now, going over the hormonal therapy, it's a little controversial, so bear with me. I'm going to try to make sure I don't create any confusion about it. So whenever I use the word hormonal therapy for any kind of sexual health problem, it's always local hormonal treatment. We are not talking about something you take by mouth. Okay, I'm talking about something that is done locally to improve that area. Okay, so vaginal estrogen is more effective than systemic, meaning by taking something by mouth, and it is effective 80 to 90% of the time in women. There are different forms of vaginal estrogen products. It can come in the tablet form called Vagifem or Femcare, or it could be a low-dose ring called Ring or Femring, or an estradiol cream called Esterase, and or conjugated estrogen cream called Premarin. Okay, and all these products are used locally. Okay, to improve the vaginal lining, give elasticity, have better blood flow in there, and the absorption from there into the rest of the body is very small. Okay, and the reason for that is because the total dose of the estrogen in those creams and in those tablets are very small. Okay, so the fear of it going into your body and going into your rest of your body to increase risk of cancer coming back is very, very small. So for any disorder that is concerning arousal or desire is direct result of low estrogen level. Okay, so women in menopausal states usually have that decreased arousal and desire, and that is because the estrogen level in the body is going down. And the treatment for that would be a low-dose estrogen therapy, and it could be local treatment again. The only FDA-approved drug that is taken by mouth is called ospemifene. Okay, and it's not a hormonal drug. It's a tablet that can be used for women who are menopausal and experiencing dyspareunia and vasomotor symptoms, meaning hot flashes and having a lot of hot flashes and frequent hot flashes, this is the only FDA approved drug. Okay. Anything else like the other products that has been tried is testosterone. I know that sounds crazy. Why would someone use testosterone? But short-term patches of testosterone have shown to help postmenopausal women with sexual interest and arousal. Word of caution with the testosterone patches, it needs to be monitored. The levels needs to be checked every few weeks. And if the patch didn't work in the first 6 months or so, then it's highly unlikely to work, and then it should be discontinued. So I'm sure many people are fearful of using these estrogen-based treatments because of the history of breast cancer, especially breast cancer that is estrogen receptor positive. Okay, so as of today, right now, there is no literature that is saying that using local estrogen cream is going to be harmful or has shown to increase the risk of the breast cancer coming back. And now this is only true, holds true for breast cancer that was estrogen receptor positive, right? There are other breast cancer that are estrogen receptor negative. So that should not be an issue at all for that kind of cancer. So this is only for the estrogen receptor positive cancers that there may be a concern that it may increase the risk for the cancer coming back. And so far studies that are done, which is not a lot of studies, it's very few studies that has been done, but it did not show that actually it increased the risk. A lot of studies showed it did not. Some of the studies showed it couldn't come to a conclusion. So the literature out there is very mixed. But when I speak to my breast oncology colleagues, they all offer their patient the local treatment if they're having too much symptoms, especially if their quality of life is getting affected, then they are prescribing this local treatment. So the vaginal stenosis is basically narrowing of the vaginal opening, okay, so that it becomes very closed, okay. And this could be a direct complication of pelvic radiation, or sometimes we see it, and more literature is coming out now with patients who underwent bone marrow transplant. Okay, so patients who underwent bone marrow transplant and developed something called graft versus host disease, that tends to attack the vaginal area and may lead to vaginal stenosis. Okay, so radiation also may lead to inflammation of the vagina and also may cause stretching or shortening of the fibers of the vagina called fibrosis, and this also leads to vaginal shortening or stenosis. The degree of toxicity may depend on what kind of radiation or how much radiation you got, and also depends on what kind of surgery was performed. Patients who underwent pelvic radiation are always offered something called vaginal dilators after radiation is finished. And that is something that the radiation oncologist asks the patients to use on a regular basis. And the reason for that is because if that dilator is not used, then the vaginal stenosis and fibrosis is definitely going to happen. And the dilator actually is to prevent it from happening. Okay, and the vaginal estrogen may improve vaginal elasticity. So this is the dilators that is given out by the radiation oncologist. What it does is, so usually patient is asked to start using this around 2 to 3 weeks after finishing radiation. And there are different sizes. So usually we ask the patient to use start with the smallest size and then build it up to larger sizes, okay? Ideally, it should be used at least 3 times a week. And then for a month and then use the bigger size next time. So if you're compliant with these dilators and you have been consistently using it, it definitely has shown to ameliorate dyspareunia. Okay, and also it may improve pelvic muscle relaxation and control as part of the therapy for vaginismus. There is another therapy called the pelvic floor therapy, and now this is done given by a physical therapist. So you have to go to a physical therapist to get this pelvic floor exercises. It consists of various external and internal vaginal intravaginal therapies, and they're tailored for each patient. There is symptom improvement by these therapies, and also the goal is to improve the flexibility of the tissue in the vagina and around the vagina, also to decrease the tension, improve strength, and increase the blood flow to the pelvic floor muscles. Other than penetrative sex and doing things to improve the symptoms, there are other things that you may try, right? So sexual stimulation without penetration, cuddling, touching, fondling, sex toy play, different sexual positions to reduce pain, okay? Find inspiration in books and online materials, using lubricants and moisturizer to ease the dryness and the discomfort. Okay, and of course, open communication with your partner about your desires, fears, and expectation, because you cannot do it all by yourself. You need the partnership. Communication, that is the key, and it helps when everyone around you understands what you are going through and how you're feeling, and especially your partners and your spouse, and be open and honest with you about your fears and desires, pleasures. Explore and validate your partners. Okay, it's best if you do that face to face, but if that's not possible, or if that's not something you feel you can do, sometimes writing it down and writing letters. It's found to be therapeutic for some of the patients because they are able to say what's on their mind by just writing it down. But they feel that is a safe way to do it without actually doing it face to face. Sometimes certain individuals and couples may need couples therapy, and and there are a lot of resources for that. So just a warning, reflections in this mirror may be distorted by socially constructed ideas of beauty. So keep that in mind. You create your beauty, Don't let anyone else tell you what beauty is. So how to improve your self-image, okay? So I know it's a journey. It's not easy. So my talk by no means is conveying that it's easy to do. That's not this talk about. It's just hoping that it will be helpful, okay? But it is a journey, and it is something that you have to do. You have to see how you see yourself, and how you adjust to the new you, right? And sometimes humor helps, okay? If that is your thing, do that. How to embrace humor if possible. Stay calm, okay? Do inner reflection and think about things, and do positive affirmation, okay? Take small steps, and every time something positive happens, be happy about it, and celebrate those steps, okay? Meditation and guided imagery may help, okay? Or sometimes buying new comfortable lingerie that you feel good wearing, that helps, okay? There are a lot of resources, support groups available if that's something you want to do. Religious leaders, friends, family, counseling, okay? And most important thing is to focus on you and things that you can change, okay? There are going to be certain things that cannot be changed, okay? That's okay. You accept that, you acknowledge that, but you look at things that you can change, that's in your power to change, to move on. Okay, journaling has helped a lot of women. And sometimes there's an exercise called gratitude journaling to reduce stress. And it may help strengthen resilience. It decreases stress and may help you focus on the positives. Okay, so the way you do it is write every day, write a couple of things that you are grateful for. And it doesn't have to be the very obvious. To think about it and see just two things, two little things. Okay, and once you have written that, monthly, read on it and reflect on it and see how far you have come. Another journaling exercise is to pick a topic, and it could be about your cancer or it could be something unrelated. And you may write about it in a letter format to yourself or to someone else. And this can be very therapeutic because you're going to express your fears, hopes, and dreams in that letter. Okay. So I just wanted to talk a little bit about a topic that I don't think any one of us talk, and I think we all are learning and how to help everyone. But it is something that we have patients who don't have a partner, went through the process of cancer diagnosis, treatment, went through everything, and they are moving forward, and now they want to be part of the life, normal life, and they want to go back to being with friends, dating, being in a relationship. And how do you do that, right? That's a big step because sometimes there are concerns about dating and sexual intimacy after cancer treatment. And but I would say, don't let that fear keep you from pursuing your relationships. Okay. These are some strategies, again, and everyone is different. So it may work for someone and it may not work for others. So some of the strategies could be try to practice positive self-talk, right? Like make a list of your positive qualities. Okay. Tell your friends and family that you're ready to meet potential dating partners. You may want to join an activity or club or class to meet other people. Sometimes it's very helpful to talk to other cancer survivors who have started dating, right? Practice a response to rejection if that is possibility concerns you. Okay. So once you start dating, right, then the question comes is when to share your experience with cancer with that particular person, right? So, because if you are going to move forward with your relationship, you have to be open about everything, right? And so the people's preferences differ when to share their cancer experiences. So I would say that you do it what you feel comfortable. You may think it may be too personal to share it immediately, that's fine. Or you may fear that it could deter the potential partner, right? So if that is some of your fears, then you wait until a mutual trust is developed and then before sharing, okay? So that is something, unfortunately, cannot be, it's an experience. It's something that only while it's happening, you can decide. You know, you can have certain guidance, but you really cannot. It cannot be like these are the steps that you have to do, right? So alternatively, sometimes you may feel that if I don't tell everything up front, I am being insincere or dishonest, right? And that is another fear. That you're withholding information from your potential partner. And so if that is your fear, then consider sharing before the relationship becomes serious, okay? So those are some of the things that you can do.
Dr. John, can I just give you a 2-minute warning because we have a lot of questions and I want to try and get to them.
I'm so sorry. Okay, I didn't even realize that.
This is
Oh,
fantastic, but I want to get some of the questions in.
sure, absolutely. I'm sorry. Let me see. So this is just to say that you're not alone. You have the healthcare providers as well as your partners you can speak to about your concerns. This is just repetition of what I said for patients to talk about your feelings and your concerns to the healthcare partner. But I just definitely want to emphasize second point. Don't assume your doctor or nurse will ask you about these or other concerns about sexuality. You may have to start the conversation, okay? And I am guilty about that, and unfortunately, we have to do our part too, okay? And of course, for caregivers, unless the caregivers and the partners know how you're feeling and what you need, they won't be able to help you. So it's important to communicate with them. Being able to talk about their emotional issues and sexual problems with a partner can also help to reassure the patient. And also, these questions may start before any treatment is done, okay, or it can continue during treatment or after treatment, okay? So in summary, I just want to let you know that as a woman with cancer, you may experience changes in your sex life and intimacy. This is normal. Feel empowered to talk about it with your healthcare providers. Learn from others living with cancer and understand you are not alone, and there are many resources to help you along your journey. Okay, so these are some of the sites. Thank you so much, and I apologize for going so long.
Please don't apologize. I know you're speaking and you can't see the comments coming in through the chat box, but people are very grateful for all that you've shared. I'm going to ask you to stop sharing your screen right now, and we'll make sure that these links get sent out in the follow-up email. And I'm going to make sure, can we see? Okay, let me just make sure we're both spotlighted. Okay, perfect. We have a lot of questions, but interestingly, as the questions were coming in, it was off in the next slide where you addressed that. So that's wonderful. There are still a couple. I'm going to ask a couple of questions now. Then I'm going to share the conclusion of the webinar, and then anybody who can stay for a couple of more questions will do that. So one of the questions was, you mentioned a couple of times that you often have to bring this topic up with your doctor. And so somebody said, there's rarely time to ask any questions, much less something like this that either is awkward or might seem not as important as making sure you have the medicine's directions down or something like that. So how do you recommend we broach the topic with our healthcare team?
So, I mean, that's an excellent question. And I tried to tell you that I am guilty of not doing my part. But as a physician who is seeing patients, and yes, I see that you feel that we are all rushed. But if a patient brings in a topic, or a concern, at least I try to listen to that part and may give you some extra time. And if I don't have the answer, I will find the resources for you to get help. And that could be by a social worker or a support group. It could be my ACP, my nurse practitioner, or my PA who can help you out with all these issues. So it doesn't, unless you bring it up, there is no way that it's going to be addressed, right? So the first step would be to bring it up and see. Most of the time, we may not sit down and have this long a talk. What we probably will end up doing is referring you to resources within our department to help you get all the help that needs to be done for this, whatever you are symptoms you're having. But if it is something specifically medical, then as a physician, I will address it.
Okay, but you're saying the topic in general is just as important as any other topic you'd address with your oncologist.
Absolutely, yeah.
Okay.
And as hesitant as you are in bringing up this topic, we as physicians are also hesitant to bring this topic up because we don't know how you will receive that question from me, right? So because it's cultural, some people don't like to be asked certain questions. So if you bring it up, we will address it.
Okay. There were a couple questions that came in about dilators. So one question is, are they still effective if stenosis has already occurred? And then the second question was, can you describe the difference between a dilator and a vibrator? And is it dangerous to use a vibrator in terms of making yourself more comfortable during a penetrative experience?
Right. So I did not touch upon one of the things. So the dilator basically is working as, I'm sorry to say this, as a penis. Okay. So if you are having sex 3 times a week, you don't need the dilator. Okay. If you're having penetrative sex 3 times a week, you don't need dilator. But if you're using a vibrator instead of a dilator, that's fine too.
Okay.
Okay. So
and if the shrinking has already occurred, can you
right. So
will the dilator work to help?
Right. Sometimes it's a little bit more difficult because the scarring and the fibrosis happen, and now you need to break that down. So depending on how much time have passed. So if it is 6 months or a year, you still can use the dilator and try to get some recovery. But if it is more than 2 years or 3 years, then the permanent damage have set in, and then it becomes very, very difficult to make some kind of improvement or progress there. Yeah.
Well, what about something like the Mona Lisa or something like that? Would that help? Could you describe what that is, and would that help in a situation like that?
So the Mona Lisa is a procedure, right? And I'm not an expert on that, so I don't want to give misinformation, but it has very limited success rate in patients who have fibrosis, okay, or have radiation changes. So it is, once the radiation changes sets in, it is very difficult to do surgery in that area.
Got it. Can you spend a moment talking about, you did at the end address people who are not in a permanent relationship but are dating, but for those who are single and are opting not to date or just aren't dating at the moment, is there any advice you can give from, I mean, I assume the physical advice is all the same, but from a psychosocial perspective about the importance of sexual health?
Right. So sexual health, it can be in terms of having someone with you, or it could be in this day and age with social media and everything. Sometimes it's the friendship and, so there is the physical part of it, right? And for that, you need someone by you, right? Then there is the emotional and the mental part of it, okay? And, virtual dating, right? Being on social media and developing some kind of friendship with someone who you're interested in, yet at the same time you're not meeting, so using the dilator and or the vibrator and any of those things, just to satisfy your sexual desire, even though you don't have a partner with you, is okay, and you should be doing that. That keeps you, mentally, physically, and emotionally healthy.
Interesting that you say it keeps you healthy. That's an important thing to remember. Yes. This may not be as optional as we think. It helps to keep us strong. Okay, let's do one more question, and then we'll finish up. So somebody asked a really interesting question. I was fascinated by this. Is there a way for us to trick our brains into remembering that our breasts were an erogenous zone if there's no feeling afterward, and if breasts were an important part of our sexual pleasure?
Right. Yeah. So that's where the cognitive behavioral therapy comes in. So you can meet with a therapist who can give you the cognitive behavioral therapy to reset your mind to think that way. Okay. But the physical pleasure of that area may not be there, but at the same time rewiring your brain to think in a different way. one of the things I do tell my patients if they bring up the issue of sexuality and body images, I say that yes, physically there is a change in your body. Okay, there is no denying that. But your brain is the same. That has not changed. Okay, so you have to use your brain to say that this is physical, this is something that I know has happened, but at the same time, you still have your brain, and brain is the master of everything. Okay, you train your brain, everything else falls into place. Okay, and for that, sometimes you need, it's a therapist to help you with that, but brain, that is the main thing.
That's pretty cool. I kind of thought you were going to say no, sorry, and you had a better answer. So that's very hopeful. Okay, I want to be respectful of everybody's time. So let me say thank you, Dr. John, for sharing your expertise. I learned so much, and I hope all of you did too. Once again, I want to thank Daiichi Sankyo and Merck for supporting this important program, and Northwell Health Cancer Center for collaborating with us. Please take a moment to fill out the brief evaluation survey, which is in the chat box right now. You can click and still listen to the end of what I'm saying, and it will give you an opportunity to request some resources, including some resources on sexual health that we have. And of course, please remember that Sharsheret is here for you and your loved ones. We provide emotional support and other programs designed to help you navigate through the cancer experience. One program I want to point out very quickly is at the beginning when we were talking about body image, Dr. John mentioned cold capping to reduce hair loss. So Sharsheret has a program. She also mentioned it wasn't covered by many insurance. So Sharsheret has a program where we provide need-based subsidies for that and other things that relate to self-esteem, non-medical expenses that relate to self-esteem and body image. Semi-permanent eyebrow tattoos, the purchase and styling of a wig, and actually three-dimensional tattooing to finish a breast reconstruction. So I put that link in and you can check that out as well. Finally, I want to let you know we have a couple of really amazing webinars scheduled as we close out the year. Our next webinar is this coming Tuesday. Sharsheret's book club is hosting Teresa Brown, author of the book Healing When a Nurse Becomes a Patient. She's an oncology nurse who was diagnosed with breast cancer, and she's going to talk about her own experience with breast cancer. Absolutely changed her perspective on the work she did as a nurse. And then on Friday the 16th, join us for our quarterly Lone Shabbat program where we explore the lights of both Shabbat and Hanukkah and how they might change our perspectives. That link to register or get more information for both of those was just in the chat box. We will be sending a follow-up email, which will include a link to the recording and a transcript. It will arrive sometime next week. Also, some resources on body image and sexual health. So from all of us at Sharsheret, thank you for joining us tonight and have a wonderful evening. Good night.
Thank you. Thank you for having me.
Bye-bye.